I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. I have with us today an international guest, Dr. Aws Faidy. Did I say that right, Aws?
Yeah, totally right.
Pretty close? Okay, good. And you're coming to us from northern Iraq, right?
It's Kurdistan region, northern of Iraq, a city called Dohuk.
Well, welcome to the podcast. I'm excited to hear about the work that you're doing. So I'm going to just let you get started in talking about the work that you do related to oral health care for people with intellectual and developmental disabilities.
Thank you. Thank you so much for welcoming. Thank you for this opportunity. My work expands more about the community services and charity activities that I do for the community, not only for the IDD people, but we have a group of IDD that we focus on doing the dental and non-dental help that we provide for them. And I do multiple projects for the community, as providing oral hygiene campaigns, awarenesses for refugee camps, IDDs, IDD centers that we have in the city, as well as public shopping malls for the homeless children, the orphanages, the elderly houses. We also do some kind of general health awareness for the people, as the World Diabetes Day, the World Cancer Day. We usually do that as a health festival in some public parks that we have in the city. We give awareness to the people. And I'm a general dentist. I also practice dentistry for some of the IDD patients that I have. They're a bit challenging, but we find a way out to treat them. And that's what I do.
So that's wonderful work. So I'm curious, how did you come to work with people with intellectual and developmental disabilities? And was it challenging to learn some skills and techniques that worked better in this field?
Well, ever since I was a dental student in college, we have a specific subject regarding children's and dental management with specific conditions. We do learn all about other conditions, but there are some specific conditions with the IDDs that we get a brief basic about them, but it's your way of how you treat them and how you find a way to connect with them and give them the courage to let you do what you want to do, like they trust you and stuff. So it's like your own way. They give you some basics, but that's not typically works for everybody. That's not the rules.
Right.
You should follow your own way of convincing the children or the IDDs, and to remove the fear from their heart, and so they can let you work for them. So after college, you don't know when you are going to bump into someone with the IDD. You just get surprised. You're working in a private clinic and a patient comes to you with an IDD and he has severe pain. For example, Down syndrome patients, I've treated so many of them. They would come so much pain, and the tooth is a reversible pulpitis. He needs a root canal treatment and stuff. Mm-hmm. So first, you gotta be so friendly with them, so you can give them the trust and make them feel safe. Afterwards, you start by techniques like not showing them the needle, or whatever you're gonna do, you're gonna tell them that I'm gonna do this stuff. And a trick that I always do, I always let them feel it physically, not only by words. Like I show them the mirror.
Yeah, let them touch it.
See yourself. Let them touch it, exactly. That gives them more courage to do it, and they trust you even more. So each time you tell them, I'm gonna do this, before you get surprised by the turbine, the water spray or sting, you not get scared and surprised. That's a bit of a trick. And as well as maybe there's a trick of giving him gifts, if you're a good boy and you let me do the job, I'm going to reward you with this gift. There's a small toy that you give them. So that's kind of a way to work with them. And one important point that I focus on is the rubber dam placement, the rubbery sheet that you isolate a single tooth, and he feels
So
more
you're
safe.
saying the rubber sheet you're talking about to isolate a tooth?
Yeah.
Okay.
To isolate the tooth, the water from the work doesn't get in his mouth. If he does any sudden movement, no materials will be swollen by him or stuff. So he feels more safe. Like you work in an isolated field. That's what we think.
Yeah,
like he becomes a normal patient. You treat him as a normal patient. Sometimes even be more. You can more work for them even more than the normal patients.
That's what I was about to say.
Cooperative.
Yeah, that rubber sheet thing would probably benefit a lot of people.
Exactly. Not only the IDDs, like all the kind of patients that feel kind of fear. We also have an approach of the laughing gas, if you have heard of it.
Mm-hmm. Yes.
Kind of a sedation that removes the fear from those kind of patients, and they let you work for them even more.
Yes, yes. So, Aws, you and I had a chance to meet at a recent conference here in the U.S., the American Academy of Developmental Medicine and Dentistry Conference. And I'm curious, having exposure to some of the clinicians here in the United States, are there some similarities in terms of either approaches or challenges in providing dental care for people with IDD, or are there some notable differences that you can highlight?
Well, there were so much differences. The way I saw the Dental Association in the United States, how much they focus on the IDDs, is unfortunately it's not the situation here as well, because here they are a bit overlooked. Even some kind of these IDD patients, like how can I say it? Clinics don't accept them. Like the dentists here, maybe they don't have that patient to work for that help seeking or health seeking. So they will just they will try a bit with him. If he lets you work, they will work. If he doesn't, he just tell you to go to another clinic. That's an unfortunate truth here. But
well, I would just say to that here that unfortunately that's a large part of the experience that people with IDD face here as well too. Now, you came to the conference that was specifically focused on people with IDD for dentists. So you did meet a lot of people that are doing a lot of great work in the field, but we definitely need to expand that acceptance throughout the whole country, because there are a lot of people that do experience that same situation where they go to a dentist and the dentist doesn't feel that they can treat them or won't see them, and same thing for medical providers as well too. So unfortunately, we do share in some of those challenges.
But the conference was a great opportunity, meeting some amazing clinicians and leaders in the IDD that changed the way of treating IDDs, even in dentistry and medicine. So it was a great opportunity. We even had a poster presentation, and all the clinicians there were sharing ideas and thoughts about our projects that we presented there. It was a great opportunity, and I got some new ideas of how to approach these patients. So it changed a lot of ways of how I'm doing things, and in a better way. So it was a very great opportunity that was amazing for me and for my career as well.
Well, that was great. I remember the first time I went to a conference years ago. It was amazing for me because I felt very isolated working in this field, and being able to be around others who are working in this field, facing the same challenges, solving some of the some of the issues, and learning from them was really important and impactful to me in my career too. And it sounds like you've had some pretty positive impacts. You mentioned a poster that you presented. What was it on? What was the topic of the poster?
Well, the poster was IDPs and refugees oral health matters. it was a part of the Alliance of Oral Health Across Borders, an organization focusing on global oral health leadership. It was a great opportunity. Dr. Deborah Weisfuse is the president of the alliance. Thanks to her, it was the opportunity provided by her to present the poster by the name of the alliance. My project was about giving proper oral hygiene awareness to the refugee camps and IDPs inside the camps. We have so many refugee camps in the country. They are all the result of ISIS attack back in 2014. We have about around 2 million IDPs and refugees in northern of Iraq. I targeted some camps. There were so many IDDs in the camps, which some of them were congenitally that happened to them. Some of them were as a result of the physiological
right, something environmental that occurred, or
environmental around the war that happened and stuff. Yeah. So people were very overlooked there. So that's why the project, my poster is the IDPs and refugees oral health matters, because they were very overlooked. I also did so many other projects for the IDDs, but the poster was specifically about refugees and IDPs and IDDs that they have in the refugee camps.
So when you go to a refugee camp or a situation like that, are you providing training and education, or are you actually providing dental care when you go?
I do both. The project's about not only awareness, also educational, and we also provide them with toothbrush and toothpastes so they can practice the education that we gave them. So it's about two parts. The first part is the theoretical part, where we take some dental modules of the mouth, some brushes, and we teach them the proper way of washing. We motivate them, we educate them, and we give them some information about dietary and what to avoid, what to minimize taking, and what to do more, as well as we target the children, so it can be more clear. And after we give them the proper education and awareness and motivation, we do it inside the tents of the camp. So from the first tent, they go to the second tent, where we give the practical part. The practical part, we have some kind of tables, and each table there's a dentist, different dentists on them, because we do for a large quantity. Each time we do around 400 children.
Wow.
So what we give there is we do a dental checkup. We record their oral hygiene conditions, and if they need subsequent treatment, we refer them to the clinics of College of Dentistry in the University of The Hague in the city, where they can give free treatment for them. We got an arrangement with the dean of the college, so there are senior students that practice dentistry on them. So we hit two birds with one stone. Like the students there get patients to complete the requirement, as well as we do free treatments for the refugees and IDPs there. And we also do fluoride varnish treatments for them, so we can increase their tooth to caries resistance. And at the end, we give them toothbrush and toothpastes so they can practice dentistry, and they continue what we have teach them. And this is not just a one-time visit and one time show up and that's it. No, that would just confuse them more.
Yeah.
We do multiple visits. We ensure they got the training, they got the learning, they are practicing, because we do have a recording of their mouth in the previous visits. And surprisingly, there was around 70% increase in oral health education and awareness and motivation. And they knew the subsequent of oral illness, what would happen if they don't take care of their mouth. So the total beneficiaries of the project was 1,200 children and the refugee camp, in one refugee camp. Wow. We are planning to do for more refugee camps, but the only obstacle is the sponsoring, because all the sponsoring I get is from either charity or donations. That's it. We don't have like any governmental or any other other support. It's all sponsoring and charity. So this is a direct impact for 1,200 children, but we also get multiplied like 3 to 4 times of indirect beneficiaries, because those children are going to tell their neighbors or their friends or their siblings or even their parents that this is the proper way of brushing. You should do this. You shouldn't be doing this. And one point that we find very strange between the children, especially they're from rural areas, that they're low educated, okay? They're from countrysides, and they're from Syria. Some of them are from originally Iraq, they're IDPs. So what they think, we have a tooth, it's called the first molar, that erupts at 6 years old. Most of them, you see that tooth is heavily decayed, heavily broken down due to decay. And you would ask him, why don't you take care of your tooth? He's around maybe 8, 9 years old. You say, oh, it's just a primary tooth. It's like a milky tooth. It will fall and I will get a new one. And he doesn't know that this tooth is a permanent tooth and it's not replaceable. You won't get a new one because he gets that tooth, the first molar, at the 6 years old. So when you give him the idea that this tooth is permanent, it's more likely that he will tell his other siblings and parents that, oh, this is not a primary tooth, I won't get a new one. So this is the idea. That's why I target the children. So they will separate it. There will be a new generation that will be more educated than their parents or the older generation that they have in the area that they came from. So they would have an indirect impact as well, because they will share this awareness as well. So I think the beneficiaries were more than 1,200.
Well, it's clear that what you're doing is having a major impact. And yeah, sometimes it's just a little piece of information like that. It's like, hey, no, wait, this is a permanent tooth. Can really say, okay, wait, I need to take care of this. Yeah, yeah. So, gosh, so you see a lot of people when you do these interventions, these clinics there. Do you have, I guess you have a group of dentists that do this together?
Yeah, most of them are colleagues with me. They graduated the same year as I did or some years before me. And when they see that I do this kind of project, they're very interested in participating. It's all volunteering work, so they like doing that. They like helping.
How many dentists do you have typically that work together on this project?
It's not a constant number because, whenever someone is available and they like to do the job, they do it. But there are around 15 dentists that we do each time we visit the camps.
That's great. That's great. I mean, that's fantastic work. And it's great to hear that that's happening where you are. I'm Dr. Craig Esquire, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. I want to ask you something that I ask all of the guests on the show. I ask, do you have any tips, tricks, words of wisdom, or pieces of advice? And I usually ask for three tips or words of wisdom that you would like to share with everyone that you think can improve health or oral health or health and wellness for people with intellectual and developmental disabilities.
Well, what I think of this kind of patients is being patient with them, because that's the major point of making a treatment for them that could happen. Being patient, treating them as one of your own family. That makes a big impact, because our work is initially humanitarian. You're dealing with a human being. They also deserve the kind of care that any other people deserve, and even more. They even deserve more care than any other kind of people. So what I think is being patient, looking at them in an ethical and humanity way, and giving all you have. That's the point. And
did you say
finding
give
your own
it
way.
all you have? Is that the last thing you said?
Giving all you have.
Yes. Yeah, I like that, and the being patient part of it. And you said something in that spot as well, about their people and seeing them as people, and that is so important. And unfortunately, we have to tell people still to see people with intellectual and developmental disabilities as people first, with wants and desires and they wishes and things that they want for a good quality of life. And as a healthcare provider, I think it's important that we help others ensure that everyone gets the healthcare, the oral healthcare that they need to be able to not be burdened by preventable conditions, to help them live as full a life as they can. So those are definitely some great things. So I know people listening are probably going to want to find out more information. How can they do that? Can they contact you, or can they contact the Alliance for Oral Health Across Borders?
If they want, either ways is okay. They can contact me, or they can donate through Alliance for Oral Health Across Borders. Typically, I get my donations sponsorship locally. I've never gotten it globally. Mm-hmm. Maybe once from Kuwait City, I got some toothbrush and toothpaste products as donations for the camps. So we can figure out, they can contact me or the Alliance. That would work.
Okay. How can they reach you or the Alliance? Do you have a website or an email address that you can share?
They do have a website. They can write Alliance of Oral Health Across Borders. They can find their website and contact info, or they can contact me via my email, aws.mahmoud@gmail.com.
Wonderful. Well, I really want to thank you for taking the time to share the great work that you're doing, and just really making people aware of the commonality really across borders, and the challenges that we all face in this field. And it's great to hear that people all over the world are working to improve healthcare and oral health for people with intellectual and developmental disabilities. So thank you for joining me today to share this information, and more importantly, thank you for the incredible work that you're doing in this field.
Thank you so much. Thank you for the opportunity.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.